The Breakfast Show 2020 on KBC English Service.
Only without context, you can understand when someone asks what is going on.
National Hospital Insurance Fund.
Yes.
We have been paying for it before some of you are born.
Yes.
So it is not an insurance for profit. It is just like where we send our funds to be managed on matters health. Now, it is sad when they say they cannot cover COVID. What is further sad is that the very people who are in there are the ones who are telling us that. I expect that the president, I expect the deputy president to confound these things and say, look, we need methods to deal with this. One of it is let's have the problem covered. And then secondly, let us have emergency hospitals in various places. This requires policy interventions, financial interventions. They don't require you addressing press conferences. Julie, if you left your house today and there is no food there, please don't sit in front of the gate there. Then you address the workers or the staff, the askaris. You know you people. What is happening? Houses now don't have food. No, come here and ask your colleague. Do you have a 200 sling to spare? I need to get back home with some food. I expect the deputy president and his people to say, Your Excellency, we need to have a policy here. What do? We need temporary hospitals that can deal with it. Maybe Jehovah has allowed some of them to fall so that they know the pain that the small person is feeling in the village. They know that we are all vulnerable. Otherwise, if they have not taken this, because then they have 50 million health cover. They have evacuation cover that you can be evacuated. AMREF, ambulance, all this. That's why they think ambulance. That's why they think helicopter. But the health professionals are telling them, you don't need ambulance, you don't need helicopter. The money that you want for ambulance actually can make sure that there is oxygen in 1 or 2 cylinders of oxygen in every assistant chief's office. The medical people are saying actually there's no miracle about it. Just put those cylinders there. And when you put them, a medical personnel, a nurse, you understand that, can take motorbike. They put this thing on over, poop, and in a few minutes, they are there. And then they put, the way it is put, it's not a miracle thing. They insert it into your lungs. And they supplement your oxygen. That's the way to solve it. But now when you hear leaders are saying, we need helicopters, then you know the devil is very fat.
Now the CS for Health put his foot in his mouth when he made an outrageous statement about the development of vaccines.
Back with the worst case scenario and say to ourselves, yes, we are hearing there is a vaccine, but I really personally, to tell you the truth, I've got my many doubts about it because we are talking about a disease that stops people from getting the virus. Now, I would like to know how they knew in the first place that I was going to get the virus so that the vaccine, you're talking about a treatment when I have a virus and it goes down, I can understand the measure. But when you tell me that I stopped you from getting the virus, how do you know I was going to get the virus in the first place?
When the world is embracing news of vaccines being developed against COVID-19, then doesn't it surprise you when the #1 public health official in the country makes wild comments about the same vaccine?
Because they are low caliber people who have risen. I'm not bragging. My own son is a postgraduate student of virology at a place called UNITID. UNITID is a department in the University of Nairobi. Department of Tropical and Infectious Diseases. They study these viruses. There you produce virologists. He doesn't know. And in there, I ask him and he tells me, Corona has been like some of the minor viruses. You study it 5-10 minutes. They are just listed until it's tracked. Now, Minister for Health has not sat down even with a basic KMTC student to ask him, teach me. Teach me. If you have been watching CNN, every time they advantageous. In fact, even Cuba is developing one. Korea, South Korea is developing one. Here, if they are asked just to allocate $1 billion shillings for research, they say what? Because our education system is based on cramming. You cram things, then you regurgitate them. Then we say we are very brilliant. That's why you see people are graduates outside there, and they are saying, I have a PhD, and they can't feed themselves. Because to them, the education they got was the one where you cram things. After you have crammed them, then you go and sit exams. Then you pass, then you say, I'm number one. Then you say, so what? But good education is about critical thinking. You make your research, you do things. How is research done? How did we know that for corona, social distance helps to protect you? Research. Not that people think research is walking somewhere to find it out. You go, I'm going to do research, so you are walking from place to place. That's not research. Research is you take data. You take data and then you observe the results. Then you make conclusions. You say, okay, some people are exposed closer, some people are exposed further. We found the ones who are further, they are not getting it. The ones who are near, then we have the protocols. Now, a minister who doesn't understand that, that is why we are not doing our own research. We are not trying to develop our own vaccine. And that's why he thinks conspiracy theories like my big brother Donald Trump thinks that this is fake.
The COVID-19 pandemic has thrown the education sector into a whirlwind, and the professor in charge at Jogo House has been feeling the heat over his style of management.
Directed by my appointing authority, I shall continue to perform all my duties and responsibilities with a zeal and commitment, and to ensure that all officers in the Ministry of Education perform their duties.
I strongly believe that for any meaningful, positive and measurable change to happen, things must be done differently.
Professor Magoha is defiant in the face of criticism over his handling of the county education director in Uasin Gishu, whom he basically called a fool when he found a school in Langas dirty and messy during an inspection tour last week. You have praised the professor in the past, but did he cross the line this time?
I looked at that clip. The professor was inspecting this school in front. The front yard of the school was very well.
Yes.
The backyard where he was walking had issues. Then when he asked about it, that officer said it is in the report. And he's saying, what report are you talking about? We are talking about it physically. Kenyans are emotional because as many of us are mediocre. We do not want to face certain realities. I don't approve of his language where he's saying stupid.
Yes.
But his reaction, I would have reacted the same way. Like I come here and I tell you, why have you poured tea all over on this table? Then you say, we already written it in the report. I said, what are you talking about? Then the student is dirty. Which report? That is how the minister was. He used inappropriate language, but the fellow had not done his duty and was trying to divest attention. He was saying it is in the report. Now, if you take the minister, the language he used was not right, but the anger was justified. We must be able to translate, to separate the two. But Kenyans, people love being victims.
Yes.
Well, I'm a victim. We are being insulted. So this professor is actually, when you rise to the level of a professor like him and having been whatever, your thinking becomes different. The only thing we tell him, you have now come into ours. This one of ours, we need to be cajoled. We need to be babied. Even if we make mistakes, you baby us. Don't bring that professor arrogance. But if you look at the facts, he was justified in being angry, but he used the wrong words.
Finally, Weda, in just about a minute, the CS also announced a new calendar of schools, basically a crash program for 2021 and 2022 to recover what has been a lost year. You're a stakeholder in this sector, Weda. Yes. What do you think of this calendar that starts in January 2021? Well,
in the circumstances, but I don't think it was justified. This thing of we have lost a year, I don't seem to understand it. we repeat schools, we repeat classes, we repeat whatever. We would have just, the mistake was they admitted others and left out others. Then there's a gap. Now, you are having class 4, but you are not having class 3, and you are not having class 5. So even when they finish, they can't move forward. Same as class 8, same as Form 1. So I think that is where they realize. But that mistake ought not to have been there. Having said so, now that they have done it, let us try to make the best of it. Let's just hope that in January, our infection rates, our graph shall have reduced so that the children are released. But if you also look at the way people are behaving, the children may be, in my view, they will be safer in school than they are now. Because here we are selecting Mutumba, jumping up and down, and then we are going home, the children are roaming the estates and whatever. So we just hope that things will be clearer. But we have to then work together for the success of this program, because it is very, very delicate.
That's our analyst, our regular analyst on the show, who helps us get a deeper understanding of the social, political and legal events of the week gone by. Ambrose Weda, advocate of the High Court of Kenya. Whether there is more tea, published author and member of the board, Lake Basin Development Authority, canon in the Anglican Church. And we want to thank you so much for your time on the
The
conversation.
Breakfast Show 2020 on KBC English Service.